Hi, you guys. Welcome back for our daily practice questions. It is day 14, but as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. Question number 1 states a 28-year-old woman presents with a 5-day history of nasal congestion, facial pain, and purulent nasal discharge. She also complains of a low grade fever and headaches. Upon examination, you note tenderness over the maxillary sinuses, and her nasal mucosa is swollen and erythematous. She has no significant medical history. What is the most appropriate first line therapy for this patient? Is it A, ibuprofen, B, augmentin, C, oral prednisone, or D, nasal saline irrigation and decongestants? Take a moment and tell me what you got in the comments, you guys. All right, all right, all right. So y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is even being asked of you, right? So here the stem of the question states, what is the most appropriate first line therapy for this patient? Y'all know I always tell you if they're asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. In the event they have not, you need to take it back a step further and look at those assessment findings and you determine what the diagnosis is because you got to know what it is to be able to treat it, right? So here the diagnosis is not provided. So let's walk through again what is going on. And I'll tell you when you're looking at the assessment findings, also pay attention to signs, symptoms, chief complaint, things noted on exam, but also three things if they are provided: the age, the gender, and the ethnicity. Okay. All right. So we have a 28-year-old female. She's come in with a 5-day history of nasal congestion, facial pain, and purulent nasal discharge. She complains of a low-grade fever and headache. On exam, there's tenderness over the maxillary sinuses. Her nasal mucosa is swollen and erythematous. Y'all, this is classic presentation for sinusitis, right? So what is the first line therapy for sinusitis? Your best answer is B, augmentin. Now, augmentin, amoxicillin, these are the common first line therapy, with augmentin being the captain, the top of those first line, okay? All right, question number 2. A 45-year-old male presents with a 10-day history of persistent sinus congestion, facial pain, and a cough that worsens at night. He has not experienced improvement with augmentin, and he has completed the prescription. On exam, you find tenderness over the frontal and maxillary sinuses and purulent nasal discharge. The patient has no significant history of allergies. What is the most appropriate second-line therapy for this patient? Is it A, azithromycin, B, doxycycline, C, intranasal corticosteroids, or D, Cipro? Take a moment and tell me what you got, y'all. So the stem of the question here states, what is the most appropriate second-line therapy for this patient? All right. So again, we're looking for the treatment. So we need to determine if a diagnosis has been provided and then go from there. So a diagnosis hasn't been provided, but basically it has been implied, right? Letting you know sinusitis, the patient has been on augmentin, they completed the prescription and have had no improvement. On exam, they're still having that tenderness over the frontal and maxillary sinuses. They're having purulent nasal discharge, and they don't have any allergies. So what would you do next if you've already treated with the augmentin, no improvement? Your second line, the best treatment is B, doxy. When we're thinking about sinusitis, like I told you, augmentin and amoxicillin are those first line options, with augmentin being the top of the top of the top, okay? When in doubt, is augmentin, right? But in the event that you cannot utilize that as we have completed it or what have you. Go with doxycycline, okay? That's your second line. Hey, we've done this. It has not resolved. All right, so we're going to go to the next stage, and it's doxy. And remember, I tell y'all, when you're studying, you need to work through the things this way. And if you have not noticed yet, it is day 14, and we have been covering all of EENT. I am trying to work y'all through systems so you can know this thing, right? I'm not just telling you all of it, but I'm breaking it down in a fashion that you are studying all aspects. And so, what I mean by that is like this: you don't just know sinusitis and know how to identify it, and just know the assessment findings, or and guessing on a treatment. You know the treatment, all right? So then. What about once you get past that first line treatment? I need you to know the next things. So, however the question is presented to you on boards, you're able to pivot and answer it because you know it all the way. You know you're studying effectively and complete, right? You're not leaving any gaps, right? So again, if you have utilized augmentin or amoxicillin, there's still no improvement, your next step is your doxy. And lastly, question number 3. A 38-year-old woman with a known penicillin allergy presents with a 7-day history of sinus pressure, facial pain, and thick nasal discharge. She has a mild fever and no other significant medical history. You suspect bacterial sinusitis. What is the most appropriate alternative therapy for this patient given her penicillin allergy? Is it A, azithromycin, B, levofloxacin, C, clindamycin, or D, augmentin? Take a moment and tell me what you got in the comments, y'all. Tell me what you got. All right, so stem of the question here. What is the most appropriate alternative therapy for this patient given her penicillin allergy? All right, so the diagnosis is bacterial sinusitis. She has a penicillin allergy. Why is this important? Because we just talked about this. First line therapy is augmentin or amoxicillin. Augmentin has amoxicillin in it, right? It's amoxicillin plus clavulanic acid or clavulanate, however they may word it on boards or whatever. Know that augmentin has a penicillin component, so we cannot give those, right? So you want to think of the next alternative options that you can utilize. So your best answer is B, azithromycin. Listen, you can also do doxy, but I wanted to provide you all scenarios so that you know what it looks like. So if we have utilized augmentin or amoxicillin with no improvement, our second line therapy is our doxycycline. In the event that there is a penicillin allergy and we can't use those first line, you can go with doxy or you can go with azithromycin as that macrolide family, okay? So make sure that you know all of your options and how that works, all right? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you guys to be sure and gauge what you really need to make sure that you are booking the appropriate session type, okay? All right, you guys, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.